hold on, because it's brand new.
It's a fresh bottle.
So I've been traveling with this for years now. And everybody, it's like a joke around the offices because everybody picks on me for, oh, hold on, somebody sneezes or they cough and I break out my spray. And
Get
then
your umbrella.
Right. Yeah, they've been making fun of me. But now they're all carrying a bottle. So what is it? Well, we have private labeled this. It's called Guardiant. Yes, you can buy it on our website. But why? Why is an ENT involved in this solution that's made out of called hypochlorous? And it's a chlorine-based liquid that we then put in and electrodes it. And in our, let's see, this is 3 ounces and it's about 800 to 1,000 parts per million just in this little bottle. And we are selling it, but more so we're using it in our clinics. So in our humidifiers right here, you can maybe see some of the steam coming out. It's a cool mist humidifier, but it is keeping our air in our clinics clean and sterile, and it kills viruses. This World Health Organization has announced that a chlorine-based solution will kill viruses. So when I go on planes, I have this whole routine. I wipe down my seats. I bring my spray with me. And yeah, I mean, months ago, people would just kind of look at me like I was the oddball, but now it's the real deal. So we have here, anyway, I haven't even introduced myself, I'm sorry, but it's the How to Survive the Coronavirus follow-up episode, but we have Dr. Sheila Pack and Cheryl Teowakin. And Cheryl is here because she's not only a physician assistant and a very valuable provider to our clinic to help you stay healthy or go through, your ear infections, your sore throats, your strep throat, your sinus infections. She works with you on all of that and getting better. But you're also a respiratory therapist.
I am.
And the coronavirus is in our scope of practice because it comes through, when people cough and they have that virus, you take it in through your nose, right? And through breathing it in. So this spray, you do put, it's safe to put in your nose. It's safe to put on your hands instead of, or in lieu of the sanitizer people are using. It's safe if you have an eye infection, put it in your eye. If you have a sore throat, put it down your throat. I mean, it is a miracle organic product. But we're not really here to push the product so much as really talk about, how do we survive the coronavirus while you can't escape hearing about it within like a second, right? So anyway, so let's talk about it.
Well,
what do we do?
People are coming into our office, and there are 3 main things that we look for. Do you have a persistent cough? Do you have a fever? Do you have a shortness of breath? So in allergy season, it's important to keep that in mind, that the congestion of allergies can be more up here, but this is more of a focused in your chest type of difficulty breathing. In our practice, people are holding their breath 10 seconds at a time, and if you can't do that, then and you have those other symptoms, it's not good.
So from a respiratory therapist standpoint, talk to us a little bit more about, the holding your breath activity in the morning or...
Okay, yeah, so with the holding your breath, it's a good exercise. It's like a pulmonary clearance where it actually helps prevent pneumonia. It just opens up the airway sacs to prevent the airways from collapsing. So it's good to, do those breathing exercises, holding your breath. It just pops open your airways just to prevent mucus from getting stuck in your lungs. Now, unfortunately, there is no cure for coronavirus, but with the growing spread of coronavirus, the World Health Organization and CDC, they do recommend, personal hand hygiene, washing your hands thoroughly for about 20 seconds. Like what Melissa was saying, use hand sanitizer and also, use the Guardiant that we're also offering. That's great, because I know I've been to the grocery store, everything with Clorox is gone. So we have it in stock for our Guardiant. Also, other good personal hand respiratory hygiene is if you have to cough, you have to sneeze, don't sneeze in your hand, just sneeze in your elbow. Just make sure you're not touching your face or your nose or mouth with your hands, because it just spreads so easily. So you just got to be really careful.
So, I mean, there's a lot of precautions out there. There's, you know, washing the hands. There's drinking water, every 15 minutes, drink water. There's staying away from people, but there's also that social isolation now, that if you stay away from people, you're going to kind of go, you know, go
crazy.
crazy. So I think this is, we know this is hitting the older populations or the people who are, have some pre-existing conditions. So I want to bring in Allison Robbins, who's our physical therapist and clinic director here. Hi. But Allison works with primarily older and dizzy patients. So, I mean, very impromptu, but, you know, tell us a little bit about, from your standpoint, what, you know, seniors are told, or people over 60, which I don't even really think seniors, but people over 60 are now, you know, told to stay home, right? And then there's a risk of, an increased risk of falling if they're not getting the therapy or they're not getting the outdoor activity that keeps them moving. So, you know, shed some light on what people at home could be doing to stay healthy.
Absolutely. So you don't want to just sit around and do nothing while you're at home. There's exercises that you can do, chair exercises even, strengthening exercises. You can always just get out, you know, a gallon of milk and just lift it a few times. That's going to get your muscles going. Get up, walk around the house a few times. Make sure in your house that everything is safe. You're not at risk for falling there. You want to be aware of throw rugs, proper lighting, etc. And whenever this all blows over, you know, if you want to come in here, we can evaluate your balance and make sure that you're safe and that you're not at risk for falls, and we can give you appropriate exercises that then you can do at home to keep yourself safe for the rest of your life.
Right. And I think the biggest thing that we're working on, aside from keeping our clinics clean and trying to keep you healthy through the Guardian product, but is also our innovation in healthcare delivery. So we've got a few things coming your way with the use of telemedicine. With Dr. Pack's team, she's going to be looking into some opportunities to get your hearing health checked even while you're at home. Do you want to speak to that real quick?
We are using telemedicine or teleaudiology as they call it, to be able to, if you're at home and you can't get in, we will be able to help you with your hearing aids. We will be able to answer your questions. We're going to be having a doctor of audiology live available to you throughout the day, starting as early as next week. It's something new that we're offering, but we think it's very important for you, so you don't have to risk it and leave your home, but yet you're still able to have the ability to hear well. So.
Yep. And so we had a second opinion clinic. If you have hearing aids and you're having glitches or you need tweaks on them, you still, from the comfort of your home, can reach out to us and we're available. So we've got lots of dynamic, innovative things coming your way so that you can remain healthy from the comfort of your home, or even coming into our clinic. So I just thank everybody for being here today and being part of this segment. So it's a little follow-up to how to survive the coronavirus. But as always, if you have ideas, we are expanding our brand and we're covering more ground this year. So how to survive, a lot of different topics are coming your way. But if you have a suggestion, if you have a question for any one of us, shoot it, you know, over to us down below in the message, or DM us, or whatever you want to do. Go online and follow us on social media, and we'll be putting together some groups and interacting with you from the comfort of your home, or come on into our safe clinics. Have a great day.